Good morning, Payne Chapel. Here's your wellness check for today from Worshiping into Wellness. October is both Breast Cancer and Domestic Violence Awareness Month. Men, this is not a time for you to leave the room. This message affects you too. Here is one of the times when Payne went pink for breast cancer, which is what I will be discussing first. Breast cancer is the second leading cause of cancer deaths. Rates of both new cases and deaths are declining. However, Black women are having higher death rates than other women, and that's due to increased screening, but later follow up to care and different treatment experience. Overall, there is a 90% 5-year survival rate. Risk factors include age, genetics, personal factors, being overweight, hormone replacement therapy, taking birth control pills, drinking alcohol, not having children or having a first child after 35, and having dense breasts. Symptoms may include a lump in the breast, a change in the size or the shape of the breast, or a discharge from a nipple. And as I said, men can have these too. Here is a good description of what happens in breast cancer screening, diagnosis, and treatment. Breast self exams and mammography can help find breast cancer early when it's most treatable. Treatment may include radiation, lumpectomy, mastectomy, chemotherapy, and hormone therapy. However, early detection is the key. Now we'll move on to domestic violence and seeing things that others may not see. Domestic violence is physical violence, sexual violence, emotional abuse, which could be verbal or psychological, economic abuse, stalking, or neglect. It is abuse of a spouse, child, or intimate partner violence. It can be broadly defined as abusive behaviors by one or both partners in an intimate relationship. Domestic violence can happen to anyone, mostly because it's underreported, but it occurs across all race and ethnicities, genders, sexual orientations, income levels, education, and ages. Some ways to help stop domestic violence includes urging that person to seek help, calling for help, praying and talking to your faith leaders, encouraging support, foster collaboration, being an ally, respect and promote nonviolence, model nonviolence and respectful behaviors, support educational initiatives and trainings, and recognize that teaching peace begins at home. If you are being abused, you should tell someone, have a safety plan, call for help 1-800-799-SAFE. Get medical care, call the police, and remember, it is not your fault. I hope that you were blessed by today's wellness check as we are staying healthy and staying safe along together.